Hello class and welcome to part 4 of lecture 6A. We are moving right along in our book and we're going to be continuing on. So let's start with partnering with families, which is actually located on page 69 of your textbook, and you realize that we don't have a lot left to actually talk about. But partnering with families, how do you do this? Your book uses the word to collaborate. And collaborate means that you come together and you work with somebody or some group of people. So your book says to collaborate with parents to ensure that their children receive similar, consistent health messages in the setting and at home. For example, if parents do not enforce proper hand washing practices at home, then the children will question the value of whether or not it's a good and proper thing to learn. And so we need to share with our families that we're learning how to wash our hands and that we wash our hands this way. And so sharing the hand washing techniques with your families, giving them a copy of the same poster that you're putting up in your classroom, giving them the health pyramid, those types of things. That is collaborating to make sure that children understand that their families are working together with you, and it shows importance. So other things that you can do to collaborate with your families is actually sharing menus and posting menus so that parents can see those. Sharing your lesson plans. A lot of times we don't focus on health and food in our lesson plans, but maybe you need to start doing that, adding that as a category in your lesson plans and saying this is what we're working on this week and this is what we're going to do. And having pamphlets available in your classroom to say, hey, it's not me saying that these are good practices, but it's the Department of Education or the Department of this or the Department of that from either the federal government, state, or just a local agency. But help to form that home language by doing those daily health checks that we've talked about, being consistent in your medication policies, being consistent in the way that we handle food and nutrition practices, and talk about, well, the health department puts this regulation on us, and this is why we do that. We're partnering with families. We do that. And a lot of times parents get upset when they think, oh, this one's telling me this and this. Oh, you just made it up because you think that's what you're doing right here at this moment. No, this is what I consistently do because I'm meeting health department regulations. I'm meeting child care regulations. And these are all set in place to keep our children healthy and safe. That's what we want. Okay. Another part of our job is this part, and this is not a fun part to talk about, but sometimes, we have to discuss things that we're not happy about. But according to the Children's Defense Fund, 750,000 children are abused and neglected each year in the United States. That is one child every 42 seconds. Children who suffer abuse and neglect, your book says, suffer side effects beyond the abuse, including behavioral problems, learning disabilities, low self-esteem, and abusiveness toward others. Identifying and reporting child abuse is never easy, but your actions can save a child's life. Prepare for the challenge of doing this by following and learning the signs of abuse and neglect to help keen to them. Make sure children feel comfortable talking to adults and expressing their feelings in your setting. Share with children's parents clear policies on handling abuse. Know how to report suspicions and be an advocate for children. According to Kara George and Kendall, 2008, there are 4 types of maltreatment. And these are the 4 types: physical abuse, sexual abuse, psychological maltreatment, and neglect. So signs of physical abuse include bruises. When you consistently see longular bruises that have shapes where you can see like a shape of a belt buckle or a shape of a brush handle, shape of a cord, a wire. These are things that are inappropriate for children to be hit with. Burns, when you see little circular burns with crust on top of them, they're just like dots on their skin. They could have one on their hand, one on their arm, one on their butt. These are cigarette burns. Can you only imagine somebody taking a cigarette and with it lit and burning you with it? Well, they do that. And I will tell you, I've been in this business for 28 years and I've seen it. I've seen bruises and parents who have bit their children and kids whose hair is falling out, and dental injuries. It's very hard to talk about because in my mind I'm seeing flashbacks of children that I have seen with in these situations. And I've seen all of them except the bald spots. I haven't seen that, but I have seen parents who have bit their children. Kids have come in and their teeth are loose, and they've cleaned them up, but their tooth's just hanging, and they don't tell you about it. I've seen parents come in and the kids have had bruises. One day they'll have a bruise over here, one day they'll have a bruise here on their arm, blah, blah, blah. And the parent, when you start questioning, they'll have a great excuse because they've already thought of a reason to tell you what happened. But when it's consistent, like 3 or 2 times out of a week, they're coming in with bruises. They're coming in with these little circular crusty spots. They're coming in with bite marks on them. They're coming in any kind of dental injury. I don't care what it is. You've got to report that. So begin to look for those things. Sexual abuse. Sexual abuse is very hard to catch. But here are some things that you can look for. Kids have pain when they're walking or running or sitting and they're grabbing their butt or they're grabbing the front part of them, whether they're a boy or a girl, or they just take their hand and hold their genitalia area and just hold it there because that's what you do a lot of times when you're in pain. You'll hold your arm, squeeze it, thinking that it'll help the pain go away. Well, that's what they do. They actually hold themselves down there. And that's because they have pain or they're itching. They constantly itch down there. They have lots of rashes. Another problem that they have is they have problems going potty and urinating. There's discharge down there. It could be bloody discharge, or it could be like a yellow clear discharge. But another thing that you need to really watch is, especially in boys who are being fondled with by another boy, and or girls too who are being fondled by same sex, or girls with older boys. You're going to see these little finger-like bruises where they're holding them and trying to get them up. And I'm sorry I'm being so graphic, but it's true. Holding them, trying to get them up to them so that they can penetrate them from the back or the front. But you're going to see bruising, not just from the actual physical intercourse itself, but from them forcing the issue within their fingers, of holding them tight, forcing them down. You're going to see bruise marks that look like fingertips. And there'll be 3 fingers, 4 fingers, 5 fingers, all in a row. You'll be able to tell that by just looking at that. That is a big sign of sexual abuse, okay? Signs of psychological maltreatment. If they're having eating problems, sleeping problems, if they're crying out in their sleep when they're taking naps, dreaming, bedwetting, self-abusive behaviors such as head banging and hair pulling are all signs of this type of neglect. And then you have signs of neglect, which is where you have, now there's 1, 2, 3, 4, 5, 6, 7, 8 types of neglect, okay? Some signs, we'll talk about those different types of neglect, but height and weight being below normal, poor hygiene, wearing inappropriate clothing in weathers, fatigue, sleepiness, those are all signs of neglect. But in physical neglect, this is where a parent abandonment or failure to meet the children's basic nutritional, clothing, or hygiene needs. Medical neglect is where a parent doesn't meet a children's medical or dental needs. And inadequate supervision, which is where they don't give the children the proper supervision, that like leaving them at home inappropriately and not having anybody there to take care of them. There's environmental neglect, exposing children to unsanitary or hazardous living conditions. Emotional neglect, failure to meet children's needs for affection and attention. Educational neglect, when children are truant from school, where it's mandatory that they go to school, then a parent can be charged for educational neglect. Newborn's addiction, exposure to drugs. That means when a child is born addicted to meth or addicted to cocaine or addicted to any type of drug, then this is considered neglect. Now, I will tell you this. As much as a parent can be charged with neglect and abuse, so can you as a provider. If in fact you do any of these things that cause a child harm, you can be charged with neglect or abuse as well. Abuse and neglect may involve one incident or a pattern of ongoing behaviors. But we just need to remember that we do not want to be a part of that. We do not want to do anything that's going to harm a child. And we need to think about our actions before we respond. And I will tell you, not to be scared of reporting abuse. Do not let fear stop you from reporting abuse. Even if you have a suspicion that abuse is happening or neglect is happening, it is your job to report that because you are working in a child care facility. Anybody else in the United States that doesn't work in a child care facility and doesn't report abuse, it's considered a misdemeanor. But if you work in a child care center, you automatically know the law according to them, because we're supposed to tell you as directors. You're supposed to sign a piece of paper, actually, and it's supposed to hang in your classroom by licensure law, that you understand the law. And to you, when you do not report abuse and neglect, it's considered a felony on your record, which means you cannot ever work in a center again. Number one. Number two, it also means it's going to affect your jobs for the rest of your life. So, I don't think we want to go there. I think we want to realize that we do not let fear stop us from reporting abuse and neglect. Now, I'm taking you back to the National Association for the Education of Young Children, which is called NAEYC. NAEYC is our mother of all mothers, and she tells us what the expectations are to be a professional early childhood caregiver or professional. And in our code of ethical conduct, this is what NAEYC says about abuse and neglect. We shall be familiar with the risk factors for and the symptoms of child abuse and physical, emotional, educational, and medical neglect. We shall know and follow state laws and community procedures that protect children against abuse and neglect. I encourage you to check your setting where you work and ask them, what is our policy? But regardless of what your policy is at your center, your number one responsibility is to report abuse and neglect. Now, one of the things that so many of you all get hooked on is the fact that your director will say, don't you ever call social services until you tell me. Well, by law, you do not have to tell your director. You don't have to tell your mama. You don't have to tell anybody that you have called social services, because it is a confidential situation. Now, if I want to collaborate with my director, which I should want to do that, and I go to my director and I say, see this, blah, 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 and the director says, say that person, the mother of that child, is her friend or his friend, and they say, oh, don't worry about it, I'm taking care of it, and then nothing's ever done, you better be calling. You do not have to obey your director. Now, I have had students who in that kind of situation, they've gone on and called, and the director found out about it and came back and fired them. And that should never happen. If that happens to you, that's wrong. Because all you have to do is go back and tell licensing again that that's happened. They'll come back in on that director. because that's not the way a child care center's run properly. And licensing will back an employee up on that. Would I want my job back in that center? No. But I would want my name cleared. And I'd want that center reprimanded or cited for that. That's what I would want. Because in doing that, you are truly advocating for quality, number one. And number two, you're advocating for children. You want them in the best, safe, most healthy environment that we can provide. That's part of our competency goal, number one. And we are finishing up on that competency goal, number one. We've got one more functional area, which is learning environment. But now let's go back and let's read, because on this part of your working on your book, we are finishing functional area 1, which is safe, functional area 2, which is healthy. And our competency standard 1 says to establish and maintain a safe, to establish and maintain a healthy. And now we know what safe means, and now we know what healthy means. We know that safe provides a safe environment. It teaches children about safe practices to prevent and reduce injuries. We know that health means that we promote health and we prevent illness. We teach children about good nutrition and practices that promote wellness. And we ensure that children are not abused physically, emotionally, educationally, or medically. And we understand that by law that we are to report, and we will not let fear stop us from reporting abuse.